With a dry ear, we'll look at the electrode needs to be cleaned very well because oils and hairspray or residue or scaly skin will get up inside the electrode, and that should be done before each patient, preferably before you treat, because they'll see that you're making everything clean and for the patient. So if you're looking for points down in the lobe, let's just take an example of the TMJ point, which would be right in this level. You want the probe perpendicular, but you also don't want it the skin to roll up like so. So you'll have to back pressure with either the thumb or the forefinger, like I have the ear here, and stretch the tissue. This would be the TMJ joint. So the ear will flex with your electrode. So placing the electrode there, 20 to 30, not more than halfway down on the spring, and to scan and find the point. That one went down to about a 2 megohm, and push to treat. And then you evaluate the patient as you're treating each and every point. The major primary master points, let's cover those just briefly. After you've treated, some treat them prior to the treatment. I prefer to go directly to the patient's complaint. If they have a headache or back problem, or they have sciatica, they have a joint problem, many times I'll go, because most of our patients are chronic, I go to the second, what we call the second phase of the endodermal layer. I look at the cervical here, perpendicular, and the lower slope of the concha ridge. I move the electrode very slowly. This one went down to 1 megohm. Push the button, and you'll hear a high-pitched beep every 8 seconds. 8 seconds is tonifying, 16 is sedating, but don't quit at 16 if the pain is leaving, if the pain is subsiding for the patient. The fewer points you treat, right points, the better the success. If you treat 8 or 10 points, it's usually 2 or 3 that do 80–90% of your work. Perpendicular again, this is the thoracic region in the ear. Very slowly, as you can see, a real slow scan. You'll find the points a lot faster by scanning very slowly. A little deeper is the lumbar in the second phase, and a little further up, just beyond 0 point, which is the little notch, right at the ascending branch of the helix, is 0 point. The autonomic point for circulatory disorders is right at the end of the sacrum spine, right in here. And you want your probe at this angle, at the end of the spine. The Shinmen point in the upper left of the triangular fossa, Shinmen. And his comes in pretty good at 1 megohm. This is it right here. The endocrine point, right in the notch here, for hormonal control for the endocrine point. For pain, the thalamus, the relay to the cortex, right in the center where the concha floor meets the subantetragus wall.